welcome back. Well, today I am joined by Kunal Kumar Vyas, who is here from OC Eye Care. Well, welcome. How are you?
Doing well. How are you?
Good, good. Well, we haven't heard much about OC Eye Care, so I'm really glad that you were able to join us and give us a background on what you guys are all about. So tell me a little bit about your practice.
Right. So we are a comprehensive ophthalmology practice. We're right in the backyard of Laguna Woods, kind of right in that community center location. And we basically take care of everything eye related.
Okay. So now, have you been there long?
We've been here for about a year now. So we're coming into our second year at this point. Yeah.
Oh, that's great. And how many rooms do you have where you can see people?
We have 3 exam rooms, and then on top of that, we have a special testing room as well, where we have all the equipment on site, from anything from glasses to advanced cataract surgery, glaucoma surgery, laser retina surgery, kind of everything in one place.
Wow, sort of a one-stop shop for everything that you might need. That's awesome. So let's talk a little about some of the cataract surgery that you do.
Sure. So some of the cataract surgery that we do, well, there's different types. So I have some props actually I could show you a little bit about what we do in terms of cataract surgery. So cataract surgery is basically the replacement of your natural lens with a synthetic lens. And it happens typically in our 60s, 70s, in that time frame. And what we do is we basically take out the natural lens and we put in its place a synthetic lens that looks something like this. And there's various different types of lenses, okay? So your basic monofocal lens that looks something like this really just gives you one focal point either in the distance or in near. And that's kind of the standard thing that's done these days. But we also do premium cataract surgeries. So we do things that will correct your eyes so that you don't need any glasses for distance or near. And that type of lens implant looks something like this, a little bit different. I'm not sure if you can see all the little rings in there.
Yes.
But all those little rings help you focus at different focal points, kind of like the natural lens when we were in our 20s. So that's some of the cataract things that we offer. We also offer laser cataract surgery and something called Verify, where while we are doing the cataract surgery, we can make sure that you'll be seeing well the next day.
Oh, wow. That's great. And is that last one you mentioned something that has only been around for a little while?
Yeah, so Verify and the LensX laser, those things are fairly new. I'd say probably around 5 years or so they've been on the market and out and about. And it's something that the newer surgeons are more comfortable using typically.
Right, I would imagine. And then, so the technology, what are the advantages with this technology?
Great, yeah, so lots of great advantages. So some advantages are, again, you can make intraoperative, so second by second adjustments while in surgery. So you can, take your pre-surgical data and adjust real time to anything that's happening inside the eye in the OR. That's one great advantage.
Okay.
And then another great advantage is the laser cataract surgery. Sometimes if we have a really, really, really thick cataract that might be difficult to take out, we can kind of break it up beforehand and make it so that the patient heals quicker, sees quicker, sees better faster.
Wow. Okay. That's awesome. And then you also do microscopic glaucoma surgery. Tell me what that is.
Yeah. So for patients who have glaucoma, it's typically like a pressure mismatch in the eye that causes, some peripheral vision damage. And for those types of patients, they're usually on drops to begin with, but as they progress, sometimes they need some surgery to help bring that pressure down.
Right.
And so I do something called microscopic implantable glaucoma surgery, where we use, I have a little model here I can show you. We use this very, very tiny, tiny blade. And we do this either during cataract surgery, or it can be done on its own. So it can be done as a combo. And I'm not sure, let's see if you can see this thing.
Oh, yeah.
Real tiny, real tiny. But that little blade, what it does is unroofs the drainage system of the eye so that the eye's fluid doesn't build up pressure. So here's another kind of representation. This is a close-up of what that looks like. And this thing just kind of unroofs the surface of the drainage system.
Oh, okay. All right.
Now, these surgeries are brand new, And so the biggest benefit is patients have drop in pressure. They sometimes get off of their pressure drop, so they don't have to keep taking drops all the time.
Mhm.
And they heal much quicker. So lots of advantages to type of surgery.
Wow, that is great. I mean, you know, technology is moving pretty fast in all facets of the medical world, and certainly our eyes are not not left out, are they? So that's
Wonderful.
awesome. Good stuff. You know, I mean, it's nice to know that you're able to administer these new technologies because, like you said, some folks who may have been some surgeons who may have been around for a while maybe not are not comfortable with that, and they're still doing the old ways. And obviously, some of the advantages here are recovery times, which must be really great for people.
Of course, yeah, recovery times is the biggest thing. So aside from recovery times, it's also the percentage of patients that respond to these procedures is far higher, especially when it comes to uncontrollable glaucomas. Things of the past, you know, they're a little more invasive, a little bigger devices, and so it's harder to heal from them. So a huge thing is that they don't work all the time either, the older devices. So these devices almost, you know, they're approaching 100% success rate. They're very, very successful in their outcomes.
Is that also true for the elderly? I mean, obviously, you know, I don't think you have to deal with most of these things until, what is it, the age of over 50?
Typically, yeah, typically. Now some children do get glaucoma and cataracts, but typically it's in the older populations, yes.
So sometimes we look at ourselves and we say, okay, if we're over 50, you know, our recovery times from injury might not be so great. But you're not really finding that with these types of
Oh no,
machines?
no. So here's examples today. I just did a surgery yesterday. The patient today is 20/20, pressure is perfect, and so the recovery is literally next day.
Well, that's exciting. I mean, I had LASIK all those years ago, and man, they sat me up on that table and I saw so far away. I couldn't believe it. So, you know, it's really refreshing, you know, when you can go right back to living the way you always used to know.
Exactly. Most of the patients are driving to their appointment the next day from
Oh,
not being able to see for years.
they must be so happy.
They're ecstatic.
All right. So one last thing, you have diabetic eye disease. I didn't even know there was such a thing.
Yeah, so diabetes is probably one of the most common things that affects the eyes. It really causes havoc, especially in the back part of the eye, in the retina.
Oh,
And I think of the retina as like the film. If you don't have a good film in a camera, you're never going to get a picture.
mhm.
And so the diabetes really affects that retinal layer. And in order to keep that healthy, it's very important for diabetics to get their eyes examined to make sure there's no bleeding or swelling in the most sensitive parts of the eye. And so we do take care of that. Not only do we examine those patients, we have the specialized equipment called an OCT that takes microscopic imaging to make sure there's no swelling in certain sensitive areas.
Mhm.
And then we also have the laser that would help treat those things in case there was any necessary treatment needed. And we also do the injections that would get rid of the swelling if there was some there as well.
Oh, and now tell me about the lasers. What kind of lasers are you using for this type of issue?
Sure. So this type of laser is called a pan-retinal photocoagulation laser, kind of a long thing. A short word for it is PRP. But that sort of laser, what it does is the process of diabetes causes faulty or leaky blood vessels in the back of the eye. And so what that laser does is basically close those blood vessels so they stop leaking. That's typically the purpose of that laser, yeah.
Is it like a cauterization?
Kind of.
Okay.
That's a good way of thinking about it, yeah.
Well, yeah, I mean, because if you're going to be going after the vessels, then that's the only way I could think of it as a stopping them from bleeding. So, how long does something like that last?
How long does the treatment last? Or
Yes. Yes.
Oh, so the treatment periods typically take about 15 minutes for the lasers. The injections are far less. The injection, you know, it's just in and out. It's
Right.
more of the time is prepping the patient, making sure they're numb and comfortable.
And then how long, like thereafter, does somebody have to come back soon to have it done again?
Oh, that depends on the level of disease. So it's kind of all variable. Sometimes no, sometimes yes. It really just depends on how much of the eye is involved, how much laser is needed.
Okay. All right. Perfect. Anything else you'd like to let our residents know?
The only other thing I like to let them know is that we are a boutique practice. And so what that means is you will see me every time you come here. There's no, there's no shuffling around to other doctors. You always see me. The other thing is your time is your time. So, there's no waiting, long waits, all that sort of stuff. And the other thing is I take as much time as we need to handle whatever questions my patients have. So that's kind of the crux. And I think that's really important in the patient-physician relationship.
Exactly. And you guys are open now, I understand, and you have been through COVID-19.
We are open through, I'm not wearing my N95 right now for the interview, but typically we're fully masked up, gloved up. We actually have reduced scheduling during COVID. We only allow 5 patients because we want to make sure that the rooms are clean before and after. Okay. And we also screen patients prior to them making and coming for their appointment.
All right. Well, thank you so much for taking the time. It was very nice to meet you.
You too. Thank you. Thank you for having me.
All right. And we'll be right back after this.